you're watching EMR News Television. I'm Kirsten Kloss. Thank you all for watching. On today's show, we're going to be talking about how creating and maintaining a culture of accountability in healthcare is enabled by choosing the right EMR platform and vendor. And my guest today is Miss Alison Green, the Vice President of Community Relations at Appletree Medical Group. Well, Alison holds a degree in biomedical science from the University of Guelph, a Master's of Health Administration from Telfer School of Management at the University of Ottawa, and a Certified Health Executive designation from the Canadian College of Health Leaders. She returned recently from a 4-month secondment as a researcher at the Centre for Innovation in Health Management, a healthcare think tank in Leeds, UK, where she examined leadership and governance in healthcare. Well, fantastic accolades. Thank you very much for joining us on the program today. It's great having you on board, Alison.
Thanks, Kirsten.
So let's look at some of these topics. My first question, why is it so important to a culture of accountability in healthcare organizations to choose the right EMR platform and vendor?
Well, we know that when we implement it to full capacity of meaningful use, if we have the right EMR platform and vendor, we then have the right underlying structure to run any healthcare organization well. Through an EMR, you can implement rules to standardize operating procedures, you can reduce error, maintain compliance with legislation and best practices in the industry, which therefore then can reduce chance of medical or administrative error, reduce the chance of privacy breaches and harm, and therefore reduce the chance of risk, not just to the organization, but to the patient as well.
And what consequences can arise from not having protective measures in place? I mean, imagine there's going to be a ripple effect here if it's done improperly.
Absolutely. We know the physician-patient relationship is based on trust. Part of that trust is also the need to have accurate, up-to-date, and complete health information. If patients have any reason at all to believe that their information is not completely confidential, they may not provide that accurate, complete, and up-to-date information, which may have serious health consequences for them because they're not giving the provider a full picture of what's happening with them, may exacerbate their illness. It may put the provider at risk because the provider then cannot treat appropriately. Of course, it may put the organization at risk as well. We know that when patients have any reason to believe that their information may not be as confidential as we ensure that it is through our organization, then not only do patients lose trust in their provider, they can lose trust in the organization, and ultimately they can lose trust in the healthcare system as well, which can have, as you can imagine, pretty far-reaching consequences.
Absolutely, for sure. Well, what advice can you offer to organizations looking for an EMR that can accommodate these kinds of requirements?
So I would say at any time, when looking to select your EMR, or if you have an EMR currently, speak to your vendor and ask questions. You want to know, can your EMR be customized to appropriately be run in your specific organization? So can it accommodate your organization's specific operating procedures or practice rules for your practice or your hospital? Is your EMR updated frequently enough to stay ahead and stay current with the legislative practice of the day? With regards to patient privacy specifically, you want to know from your vendor if, for example, if they have an audit trail. So if there is a suspected privacy breach, do they maintain a track so that you can see who did the breach, when it happened, and what was accessed? Speaking in a more preventive manner, does your EMR do, for example, role-based access control? So you want to make sure that everybody in your organization has the access that's appropriate for their position, no more, no less. And that needs to be customized it can be customized all the way down to the individual if your EMR is able to do that. In addition, can you generate alerts to, for example, administrators if there is suspicious patterns of behavior, if there are individuals accessing areas that maybe they shouldn't? Can you create alerts to the administrator and to the employee as well? For example, if they're accessing parts of a chart that maybe they don't usually do, can you have an alert pop up saying, do you really need to access this now? These are all parts of an EMR that are customizable and that can be created or used in your organization to make it safer for patients and for the organization as well.
Well, really good points. Thank you very much for sharing these with our audience today, Alison. It was great having you on the show.
Thanks, Kristen.
Our guest today, Ms. Alison Green, the Vice President of Community Relations at Appletree Medical Group. You're watching EMR News Television. I'm Kirsten Kloss. Thank you all for watching. Stay tuned again real soon. Bye for now.